Obtain an Apgar score whenever the neonate is resting, on the mother's abdomen or on a warm surface, such as an overbed warmer. At 1 minute after birth, first auscultate the neonate's heart rate with a stethoscope. Assign a score of 2 for a heart rate of 100 beats per minute or more, 1 for a heart rate of less than 100 beats per minute, or 0 for an absent heart rate. Second, evaluate respiratory effort by observing the neonate's chest wall movement. Give a score of 2 for spontaneous respirations and a good strong cry, 1 for irregular or slow respirations or a weak cry, or 0 for absent respirations. Third, assess muscle tone by determining the degree of flexion and movement in the neonate's extremities. To rate muscle tone, use a score of 2 for well-flexed extremities with spontaneous, vigorous movement, 1 for some flexion of the extremities and sluggish movement, or 0 for limp or flaccid extremities and no movement. Fourth, test reflex irritability by stimulating the neonate's nares with a bulb syringe or catheter and noting the response. For scoring this factor, give a 2 for a prompt response such as crying, sneezing, or actively moving, 1 for a minimal response such as grimacing, or 0 for no response. Finally, observe the neonate's skin color. Assign a score of 2 for overall pinkness in a light-skinned neonate, or the absence of cyanosis in a dark-skinned neonate, 1 for a pink body with blue hands and feet, or 0 for overall blue or pale skin. Total your scores for each factor to determine the neonate's Apgar score, then interpret the score. An Apgar score of 7 to 10 is normal and suggests a healthy adjustment to extrauterine life. A score of 4 to 6 indicates moderate difficulty in adjusting to extrauterine life. A 0 to 3 signifies difficulty in adjusting to extrauterine life. 5 minutes after the birth, obtain another Apgar score. If the neonate appears distressed at any time, call for assistance and intervene as needed. Be aware that these Apgar assessments have been separated for instructional purposes. In reality, you can assess color, respirations, and muscle tone while checking the heart rate.